welcome.
Hi, Sarah. How are you?
Great, thank you. How are you?
Good, thanks. How many minutes do I have? Is it about 7 or 8 or 10 or something?
We're going to go for 15.
That's with questions and answers, yeah?
Yes, so if it goes a little bit over, that's okay. We are the last session of the evening. So
Yeah.
I will open up for questions. Yeah, I'll do a quick 30-second introduction. If anybody does have questions, you can pop them in the chat. If you're screen sharing, you can start that. If you are screen sharing, you won't be able to see the chat, so I can read the questions out to you. Otherwise, you can stop screen sharing at the end and view the chat questions yourself. It's up to you.
Okay. Yeah, I'll should only be about 10 minutes, and then we'll leave 5 minutes for questions. With the proviso that I don't actually do anything to do with admissions or so. Once they're here, I deal with them, but until students start, I really have nothing to do with that whole process. So I'll let them know that up front.
Okay, perfect. Thank you so much. Well, thank you so much. I'm just going to do a quick introduction here. So welcome to our University of Queensland presentation. So it's going to be about studying dentistry at UQ. And we have with us today Dr. Matthew Nangle, who is one of the external engagement coordinators and phase 1 program coordinator for the program. So I'll let you get started, and thanks so much for joining.
Thanks, Sarah. Hello, everyone. I'm just going to share my screen now. Hopefully you can all hear me and see the presentation. Okay, all good. So everyone can see this. Let me know if there's any problems, Sarah. So as Sarah said, my name's Matt Nangle. I'm the phase 1 coordinator at UQ. What that means is essentially that I oversee the academic activities of year 1 and 2 of the 5-year undergraduate program here in dentistry. And I also happen to be the external engagement coordinator. So I deal with a little bit with international relations, but more, outreaching the school to other professional bodies and the like, other educational facilities across Australia and beyond. So UQ, dentistry at UQ, it is the largest facility in Australia, and it's a pretty new building as well. So UQ is a pretty well-established, research-focused, intensive university with an excellent background in teaching and learning. Typically ranked in the top 50 of universities worldwide, with about a $2 billion per year expenditure or budget. So it has more than 55,000 students with 7,000 full-time staff, plus many, many more part-time staff as well. And the Oral Health Centre, or OHC as we call it, opened in 2015 and replaced the older dental school. As part of this brand new building and bringing people into the fold, the largest public dental hospital in Brisbane also closed down in 2017, and we took on those staff as well here at the University of Queensland. So nowadays it is a joint pact between the University of Queensland and Queensland Health, which is the public health governing body in Queensland. There are more than 170 dental chairs spread throughout 11 clinics in the building, and this picture on the lower right is pretty typical of what we see. Most of the clinics have a sort of a similar look and feel. Each cubicle has its own chair with these sliding glass doors, which are radiation proof because each chair also has its own radiation apparatus. So you can do everything chairside. You're not having to march patients throughout the building to do various things. We try and keep it all within clinic just to make things run more proficient. How many spots are offered a year is a good question. We do 2 rounds of offers from my memory or knowledge. So I think more than half of our students in the dental school are international students. In fact, of the 55,000 students at UQ, more than 20,000 are international students. So we do have a large intake of international students. 88 places are offered in total every year. And more than half will go to international students. So between 40 and 50, perhaps even more in some years, are taken up by international students. The actual admissions, acceptance and processing I don't deal with. I deal with you once you actually get here into Brisbane but it's a good question. Next slide. So what is dentistry? Look, I think it's a quite exciting degree to undertake. It is a hard degree. There's no getting around that. You will be pushed hard for the whole 5 years of the degree because we have to get you to a level where you are safe and proficient to practice on your patients after graduation. You are qualified as a fully registered dentist. And my understanding is that Australia and Canada have bilateral agreements. So when you're qualified here, you can practice in Canada and a few other countries without requiring any further examination. But what's really good about dentistry is it is a science and an art. So there's a science to the diagnostic and clinical aspect, but there's some artistry involved here. When you're particularly dealing with the dentition itself, with teeth themselves, you're having to restore, you know, highly complex anatomical features to within microns of accuracy. People do not tolerate changes in their dentition very well if they don't feel like they did before, and it can cause problems and painful problems as well if you're not getting what we call the occlusion completely right, how the dentition comes together. But even in general dentistry, you know, you can do soft tissue surgery. There are other procedures, surgical procedures beyond the dentition. So our job is really to deal with all of the diagnosis and treatment of medical conditions within the oral cavity specifically. So it's a kind of a branch of medicine which has gone off on its own thing. But basically you are a medic of the mouth is the way to think of it. We do all types of dentistry here at UQ, from you know, checkups, fillings, and the basics, endodontics, which is root canal treatment, so removing the living tissue from the tooth, the nerve, and all the various specialist disciplines that exist: periodontics, prosthodontics, orthodontics. All of this you are exposed to at undergraduate level. Even if you're not doing some of these more specialist based procedures and treatments, you will get exposed to them. We do observations, and if you're interested, eventually you can choose, after a few years of general practice, completing your degree, to come back and specialize, which at UQ is another 3 years of specialist program to become a dental specialist, but you qualify as a general dentist. Skills. You cannot underestimate the requirement for good communication skills. So dentists are not immune to complaints from patients. It's a part of life when you're a health professional. You know, touch wood, I haven't had one yet, but it is not uncommon. And in the vast majority of these cases, it's a breakdown in communication between yourself and your patient. So having good communication skills, social skills, is really half the job, even though when you're an undergraduate student, you're so focused on the technical skills and the clinical skills. Just bear that in mind. Yes, you do need good dexterity, but even those that are a bit slow off the block, we get you up to speed. Just the sheer exposure and practice over 5 years. You know, nobody gets into their final year without having the hand skills that are required. So it is something that, you know, we can catch everyone up on if required, if it doesn't come naturally. Other things, yes, you do need to be compassionate. You will be dealing with people in all kinds of states of distress and pain. And you need to be very clear and concise with what you found, what you recommend doing about it, and then how you go about doing that as well, particularly dealing with vulnerable populations, the frail and elderly, or very young children, or of course, physically or mentally affected individuals. And you do need a commitment to lifelong learning. So as I've said, you'll graduate with what we call safe and proficient practice, but by no means are you an outstanding general dentist when you graduate. That's something that comes with many, many years of practice, many, many years of continued professional development and additional courses. And in Australia, anyway, you are actually legally committed to a minimum of 20 hours a year of additional study, if you like, clinical courses and the like, every single year that you after graduation. Class schedules, I will get to class schedules outside of clinical, so we'll get to that in a moment. Excuse me, which is right here. So look, I oversee the academic activities in years 1 and 2. So this is just a snapshot of what we do in year 1 and 2. I don't expect you to take this in, but as you can see, there's a heavy focus on what we call basic sciences. So we work with the School of Biomedical Sciences closely. We also work with the School of Chemistry and Molecular Biosciences, as well as having our own dental specific courses that we run on site here in the school, to give you a really good foundation of dental and medical and anatomical and physiological sciences before you begin seeing patients. We do listen to student feedback as well. So the little asterisk down there at the bottom, we have had a number of students, we have had for about 4 or 5 years, students in year 2 undertaking a year 3 level biochemistry course. It's difficult, but that's because that's the level we expect you to be at doing medicine or dentistry at UQ. You need to be the sort of top brass. However, we are going to replace that course with a more sort of year 2 dental specific course. So we do listen to student feedback. We have all various committees. Most of our committees now have student representatives, so there's open, transparency in what we do and how we operate at the university. We don't just have academics behind closed doors. We're much more open and transparent in this day and age. You do undertake a dental practice course throughout years 1 through 5. So dental practice in year 1 and 2. What we do is we actually have you operate, if you like, for a better word, on each other. So we tend to do that in a role play scenario where you'll have a dentist, dental assistant, patient, and possibly even an observer, all working together and learning from each other as you go. So you do carry out some procedures on each other. My personal favorite in year 2 is when we get you to give each other local anesthesia. So giving injections is always a bit of fun, at least for the academic watching and supervising. This is the building, the Oral Health Center. It's on a hill, so this is the top end. This shows about 1/3 of the building. It's a 7-story building, but at this end, you can see 3 of the stories are actually underground. So at the other end of the building, you get the full 7 stories, or actually 6 stories above ground. There's 2 levels of car parking beneath. So we do have our on-site cafeteria with inside, outside dining. We do have a student hub, so students can coalesce and work together with revision and study rooms. A lot of it's open plan, but there are also separate, rooms for more privacy if required. And all of the sort of IT, computing things you'll need on site as well. Although most students, of course, will have their own laptops these days and work with them. The top left picture there actually shows the other end of the building. As you can see, it's quite a sort of eclectic looking thing. It's got lots of bits jutting out and sticking out all over the place. And if you're into architecture, you may be interested to know it's won several architectural awards. It's a really flashy, nice, brand new building to work in, and it's definitely the envy of everybody on what we call the Hurston campus. So the Oral Health Centre is with the medical school and adjacent to the Royal Brisbane Hospital, which is the largest hospital in Queensland as well. So we're the sort of envy of everyone on campus, which is nice. The lower picture on the left there shows one of our waiting rooms for patients. It's empty, of course. This was taken when the building was opened. But it's a pretty nice place to be. Imagine you're a patient sitting on, that's level 6, with views across the local public golf course and the city skyline in the distance. It's a pretty nice environment to work and study in. Again, most of the clinics have a similar format. The dental chairs are pretty standard from most clinics. There are some with more fancy sort of high power microscopes for endodontics and overhead televisions and cameras and so forth for higher end dentistry. But That's just the stock standard clinic chair that we have. Again, radiology apparatus per room as well, so that limits movement around the place. This is our main auditorium down here. It's configured so that there's not each step per level. These levels are at the same height and then the same height, and that's so you can convene and have sort of tutorial-based learning as well. So it's not just the traditional lecture style theatre. We use it for other things as well. This was one of our final year students at the time working on a pediatric patient. These chairs are a bit different from my memory. They actually have massage functions and all kinds of things, so people can get quite comfortable in the dental chair even if they're apprehensive. And of course we have what we call preclinical education. So in the first 2 years particularly, but continuing through year and 4 to do more complex dentistry, you do that in a preclinical setting. So you do it on we call a phantom head or a mannequin, and that's where you do the bulk of your practice on fake teeth, plastic teeth. So we have 2 labs for that. One seats about 106 and the other one's about 50 or 60 as well. So there's plenty of space for everyone to get comfortable and work alongside each other. I'm going to finish with something I usually finish with because it's, especially in Australia, people always ask this question, how much will I earn? It seems to be the most important thing. Look, in Australia, dentists are very well paid. What I will say is, this starting salary is from about 5 or 6 years ago, average starting salary. And that's below what most people will actually get because it includes people who only work part-time or whatever. So even in the public system in Australia, you'll earn a 6-figure sum your first year out, potentially much higher in private practice where you're paid on commission. So it is well paid, but you'll only get out of dentistry what you put into it. So if you work hard as an undergraduate student, you're diligent, you attend all recommended classes, not just mandatory classes, your capacity to become a very, very good dentist with a very comfortable lifestyle increases. So there are dentists at the lower end of this effort, if you like, in their undergraduate years, and that they're not going to be making as much money as their colleagues, to put it quite bluntly. Okay, were there any questions I missed? Sorry, I'll stop screen sharing here. The chat.
Yeah, so I think there were 2 in the Q&A, but the class schedules and how many spots. So I believe you answered those.
Oh, class schedule. Yeah, good question. Do you know what? I'll screen share again. And actually, what I'll do is I'll get up the proposed class schedules for this year. So
great.
Year one. Just give me 1 second. So please don't copy screen this or share this. This is not necessarily final and accepted. Oh, the specific course change for biochemistry happens this year. So 2021. Yeah, so it was approved. It was approved last year, so it's going to change. So what that basically means is rather than the biochemistry being taught purely as biochemistry by biochemists, we're going to try and get involved. So about 1/3, maybe even 1/2 of the lectures are going to be delivered by dental staff, dental academics. So it really be much more integrated course for you guys specifically. Where I'll share this. So what I have here is a timetable for year 1. Not all of this needs to be attended. So for example, Biome 1051, you won't be attending every single one of these classes. It depends which tutorial group you put into or whatever. Those that would be on site this year would undertake 3 hours of, 3 hours of clinic a week, 3 hours of pre-clinic a week, and then the rest is mostly lecture based. When you get into year 2, you'll do 3 hours of clinic and 6 hours of pre-clinic. So you'll be doing 9 hours a week of hands-on work. But as I've mentioned, there has to be a focus on building up your basic sciences knowledge. So we can't have it. The clinical work tends to be what I would call the more fun stuff, but it's still challenging. You still need to be assessed and graded, but we do have to get you up to scratch in all the medical knowledge as well. I'll answer a few more of these questions as they pop up. Requirements for those with an existing degree. I'm sorry, I'm not too sure about that. What I can do, Sarah, is maybe email you names for contacts, but I think Sharon would be the best to answer these kinds of questions, because as I've mentioned, all of the admissions are undertaken no longer at a school level, but faculty level, which means when I'm working as a dental academic in dentistry, I don't have to deal with any of this anymore. I'm not involved in it, because it's wider faculty which has taken on ownership of our admissions.
If you do have any questions about admission requirements or prerequisites or anything as well, please contact Alexa. I'll pop her email address in the chat as well. So it's alexa@oztrekk.com. She's our dental admissions officer. So she'll be able to help you with the full application and the whole process.
In regards to admission, is the average calculated from, do you mean your average grade, I'm assuming? Okay, so this is an important change. So we have a system called a GPA at UQ, a grade point average. Your final GPA is an average of years 2 through 5. So you are graded in year 1 for the purpose of your studies report, but that will not count towards your final GPA. So you do get a bit of leeway in that first year to sort of, just get used to the system, get used to the environment, make friends. It's really important you make friends and socialize as much as you can in that first year if possible. I won't get into too much stuff to do with COVID, but assuming you guys want to apply and it would come next year, we should all, hopefully most of us, be vaccinated by then. Everything should be back to normal. There are no promises, of course. And the grading is numerical. So it's out of 7 being high distinction, 6 distinction, 5 is credit, 4 is a pass, and anything below 4, so 0, 1, 2, 3 is a fail. So the joke at UQ is 4's open doors. Okay, so if you pass, you pass. You still get to put those letters after your name. But as I've said, you'll get out of dentistry as a career what you put in. So if you aim high, you'll achieve high, and you'll have a much more happy and prosperous career, I would think. In terms of numbers that we take in the admission, it is 80 a year. That's pretty standard because we have a limited number of chairs. So if you think of 80 times 5, that's just our undergraduate cohort. We also have about 30 plus postgraduate students doing specialist dentistry as well. We do have, we're trying to get 1 or 2 chairs set aside for clinical research as well. So as part of the BDSC honors at UQ, the reason you get the automatic honors title without having to earn a certain GPA is because you do an intensive research project, meaning you start planning and studying for research in year 4, and then you undertake a 1-day-a-week research project in year 5 throughout the whole year. So the final year is 4 days in clinic, so 4 whole days in clinic. So it's pretty intensive. Most of you go on placement, meaning you go external to the school. We send you out to various clinics across Brisbane, across Queensland, and even interstate, where we can get those agreements in place. But you do set aside 1 day a week for your research project as well, which is graded. And that means everyone who passes the course qualifies with honors. So that's quite new as well. That's only been around for the last 4 or 5 years. If you have an existing undergraduate degree and applying to the dental school, yeah, again, I'm sorry, I'm going to have to refer you off for an answer to that. It is a good question. I know that it's not a perfect system because something called the ATAR, which we use in Australia, if you have a pre-existing degree, you can't even reach the limit required. So we're aware of problems with the numbers that we get from these grading systems, and we do try and screen all applications in a fair and equitable way. But it is a very popular degree.
Yeah, and we can filter out a lot of that stuff through OzTREKK as well, because we do the whole application process on behalf of the students, really, and kind of keep them up to date along the way. So if you have questions about that, pass it on. We do have 15 minutes left in the fair, so if you do have any more questions, please head back to the Career Echo platform. Still chat rooms that are going to be open for the next 15 minutes, but thank you so much to the University of Queensland team and Dr. Nangle. We really appreciate you joining. Thank you so much for your time.
Thank you very much, and good luck to everyone in your applications.
Have a great rest of your day or evening, wherever you're coming from.
Okay, thank you. Bye now.
Bye now.
Bye.